Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hi, hello everyone. I'm Dr. Puneet Malik. I work as a consultant neurosurgeon in Yashoda Hospital, Ghaziabad, and I have my clinic by the name Neuro Clinic in Kavinagar in Ghaziabad. So today we are going to talk about epilepsy. This is an epilepsy week, and definitely there is lots and lots of awareness which is needed when it comes to epilepsy.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So to understand Caesar, you need to understand one very basic thing. For every small thing you think, you feel, brain sends small electrical signals, right? So when a Caesar happens, when the abnormal signals in your brain increases beyond a proportion that brain is able to tolerate them, right? So basically, seizure is the presence of abnormal electrical activity in your brain, which can manifest in various forms. It can manifest as a jerky movement, it can manifest as convulsion, it can manifest as staring look, it can involve only your face or your hand, right? Anything abnormally happening with your body can be a seizure.
What is epilepsy?
Epilepsy is when you have multiple seizures, like you have two or more attack of seizures of such kind of jerky convulsive movements. That is what is called an epilepsy.
What are the different types of seizures and do they affect people differently?
Yes, definitely. Seizures are of many types. Grossly, when we divide it into two subgroups. It could be either focal or partial or generalized. What do you mean by focal or partial seizure? That is, it is affecting only one particular part of the body. For example, a focal seizure originating in the part of the brain which controls your hand may involve only abnormal movement of the hand, or it may involve only the leg. So that may cause the focal or abnormal movement of the leg. Same way it can happen with your face or just one side of the face, right? So that is focal or partial seizure, which affects your body partially, right? You may retain consciousness in that kind of seizure. But when it is called generalized seizure, that is when you lose consciousness, it involves your whole body. It can cause, in general, the jerky movement, the convulsive movement, or make your body rigid for a while, right? So that is, these are two gross type of seizures which you are supposed to know. There are many other types, particularly which is commonly seen in children, is a staring look, like there is no movement at all. uh, there is just a stare kind of look. That is also a form of seizure, what we call as absent seizure.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
See, this is again a very common myth when we talk about epilepsy or seizure. It is not necessary that in every case of epilepsy or seizure you will find an underlying cause. Most of the times, the cause is not known. When we talk about common causes, infection can cause seizure. Yes, there are few common infections like TB, neurocysticercosis, which can cause seizure. In kids, in children, high-grade fever per se can cause seizure. In adults, following head trauma, patient may develop seizure. There are certain brain lesions like tumor, vascular malformations can cause seizure. Other than that, when we talk in old age group, certain dementias, Alzheimer's, they can also cause seizure. When we talk about epilepsy, it could be associated with a family history also in certain cases, right? So these are few common causes of seizure or epilepsy which one need to know. But it is not necessary that every time you will find a cause of seizure.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So as I said just now, epilepsy can be focal or generalized. So just any abnormal twitching, abnormal facial movement, deviation happening, which is persisting repeated movement of the hand, leg, jerky movements of the body, losing consciousness, fainting, just a stare look, right? So these are the various signs and symptoms in which an epilepsy or a seizure presents, right? One need to be aware of these signs. Then, other than that, your clenching of teeth, your tongue bite, sudden loss, urinary incontinence, it all can happen during seizure, right? Many a times, patient of seizure may present with injury following a fall, or certain times old age groups present with multiple fractures, like they have repeated history of seizure and fall followed by fracture. So there can be the spectrum can be really wide. Patient presentation can be in n number of ways of a patient of seizure.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Tell you, epilepsy is there since a long, long time, right? Since years, people have their own definition of epilepsy. Some said भूत का आ जाना, है ना? Body किसी और के काबू में या वश में आ जाना. Like these are common myths which were associated with epilepsy centuries back, and unfortunately, still some people believe that it is not because of the abnormal electrical activity in the brain, rather it is because of all the things which their ancestors told them. So what they do is, they think marrying such a person is not right, or letting their kids play with these people with epilepsy is not right, or something it will get transferred to them if they'll come in touch with them. So they are common myths which affects the life and the mental framework of a patient of epilepsy who is already going through a lot, is on medication, uh, have his own mental pressure to deal with, and then all these social stigmas worsen the situation. So it is really, really important for our society, for our community to understand that these myths are not true and can significantly affect and impair the life of a patient of epilepsy, right? At present, when we talk about epilepsy, it is treatable, it is many times it's curable. Patient on medication can have a controlled disease and a good quality of life. And these stigmas only worsen the situation. Sometimes it leads to significant stress in patient, which aggravates or worsens the attack of epilepsy.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
See, when we talk about common trigger for seizures, you need to know anything which adds on to your stress. It could be decreased sleep, which can increase your stress levels, or not taking diet on proper time. Your meals are not regulated, or flash of light or very loud sounds. They can also affect and cause seizure. Very common thing, missing your medication. Then in women, at times it's seen during periods, or during menstruation, menstrual cycles, when the stress level increases, that can also trigger such kind of attacks. So it is recommended that you maintain a notebook or a diary where you specify what all, or when all you had your episode of epilepsy or seizure, and you document it so that you get an idea about your triggers.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So, as I said, again, take proper sleep, take good meals, proper meals, on time meals. Do not skip your medication. Avoid places with a lot of lights, flashing lights, or loud sound. Uh, be in a positive circle, right? All these things definitely can significantly reduce your chances of developing a seizure and can make a life of a patient of epilepsy much better.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
To prevent injury during seizure. Families or houses where a patient of epilepsy lives. So please take care that you don't have very sharp pointed edges of the tables. Just keep it padded. Use carpets in your house. Use non-breakable dishes. Um when a person with seizure is managing things alone in the kitchen, he should prefer using microwave over a stove, right? So these are common things which you can take care in your home, in your family for a patient of epilepsy. And definitely, as I said, mental support definitely means a lot. Providing them a positive environment and a good circle, and time taking medications timely definitely is very, very, very important when we talk about managing patients of epilepsy in their households. I mean, definitely it's not only medications, it's not only doctor, it's the entire circle, entire community which matters when it comes to patients of epilepsy.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So you have to understand one thing: epilepsy at present is treatable. Please do not attach any stigmas or wrong myths, which definitely do affects the mental well-being of a patient of epilepsy. uh, Take care of them, love them. They are as good as you are, right? Just because of epilepsy, they should not be differentiated, right? They have got all the rights: right to marry, right to have kids, right to live a normal life just like you and me, right? Please.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.